The approach of tube placement. The main catheterization methods: subclavian vein catheterization, internal jugular vein catheterization, and femoral vein catheterization. Internal jugular vein anatomy starts at the base of the skull and in the neck. Sternocleidomastoid muscle. The upper vein lies middle to the anterior margin of the sternocleidomastoid. The middle vein lies below the anterior margin of the clavicular head of the sternocleidomastoid. Common carotid artery. Subclavian vein, innominate vein, superior vena cava. Its diameter can reach 2 cm when dilated. Right internal jugular venous, innominate vein, superior vena cava. Internal jugular venipuncture. Anterior approach, middle approach, posterior approach. Preparation of articles before puncture. Disposable central venous catheter kit. Heparin saline, L-dopa, 1% lidocaine 5 ml. Pour L-dopa, 1% lidocaine. 18-gauge puncture needle dilator, central venous catheter. The length of the catheter was 20 cm. Guide wire. Catheter fixation clamp. The patient lay on his back with his head low, his face turned to the contralateral, 45 degrees to 60 degrees. Routine disinfection. Mark the cervical artery and vein, touch the triangle formed by the clavicular head, sternal head of the sternocleidomastoid muscle, and the clavicle with your left hand. Take the top of the triangle as a point and lay down the towel. Hold a small needle in the right hand for cutaneous and subcutaneous cervical anesthesia. Aseptically wrap the ultrasound probe. Puncture with 18-gauge puncture needle under the simultaneous guidance of the probe. The needle insertion direction is in the same plane as the probe. The needle shaft is parallel to the midline. The needle is inserted at an angle of 30 degrees to 45 degrees to the skin. During the needle inspiration process, slightly negative pressure was maintained in the syringe, and the needle tip entered the internal jugular vein when venous blood was drawn. When the blood was extracted and injected unobtrusively, the position of the puncture needle should be fixed, and adjust the needle position if resistance is encountered during insertion. The insertion depth of the guide wire is about 10 to 15 cm. Withdraw the needle. Pay attention to not taking out the guide wire when withdrawing. Take care to keep the operation clean. Use a dilator for subcutaneous expansion when the tip of the dilator is close to the puncture point. Tighten the skin around the puncture point with the left hand and hold the dilator with the right hand to expand the skin and subcutaneous tissue. Pay attention that the force should be uniform. And hemostasis when withdrawing the dilator. Put the catheter outside the guide wire and enter along the guide wire when the tip of the catheter is close to the puncture point. Tighten the skin with the left hand and slowly insert the catheter with the right hand. Insertion depth is commonly 12 to 13 cm. Withdraw the guide wire. Extract blood unobstructed. Install the heparin cap. Wash once with heparin saline. It can be used for CVP or infusion. Fixed with catheter fixing clip. After local infiltration anesthesia, the catheter fixing clip is fixed with sutures. Covered by braceable dressing.